I'm sure it's no secret that a lot of people in the US lack access to healthcare. Most analysts have attributed this to lack of access due to financial reasons or a lack of access to providers. The hardest hit areas by this downfall of care are in rural areas. And just so we're clear, when we say rural, that includes all races of rural communities: Black, white, Native American, Hispanic, etc. While researching this topic, I found it to be interesting how this story paralleled the lack of access to fresh food and grocery stores for these same areas. We found that most big box store closures like Walmart, Target, Kroger's, etc. were linked to declining populations, meaning that a number of rural communities are without an adequate customer base for a local store, which led to low sales. Now compare that to the lack of doctors. By far, the number one reason most doctors do not practice in rural areas is due to lower pay and also not enough consistent customers. As Industry Unfiltered always says, it's about the money. This is where Dollar General comes in. Dollar General has made their core business centered around underserved, economically impacted rural communities. While many large retailers are closing locations, Dollar General executives said they planned to build thousands of more stores, mostly in small communities that have otherwise shown few signs of the U.S. economic recovery. The more the rural U.S. struggles, company officials said, the more places Dollar General has found to prosper. Also, Todd Vasos, the CEO, stated, "The economy is continuing to create more of our core customer." As you can see, Dollar General thrives in areas of economic depression. An average yearly salary in rural communities is $40,000 a year. So it is unsurprising that the Dollar General is looking to monetize the lack of access to healthcare experienced by their customer base, which is about 40% of US shoppers. During the COVID-19 pandemic, several big box chains started to look into or begin investing in the healthcare world. Walmart, for instance, has always had an interest in increasing healthcare products and pharmacies in their stores. They're now looking at investing in primary care. CVS has added telehealth visits and MinuteClinics in some states, and Walgreens invested $1 billion in VillageMD, a service that provides primary care clinics and telehealth services. But unlike Walmart, CVS, and Walgreens, Dollar General already has a very strong footprint in rural America. It is estimated that 3 out of 4 rural Americans live within 5 miles of one of their stores. With Dollar General seeing this opportunity, they're now setting out to close the gap in rural healthcare delivery with mobile clinics in their store parking lots to start with. For some, this raised questions of concern and elicited praise from others. In January, Dollar General rolled out mobile clinics in 3 Tennessee locations for preventative care, urgent care, and chronic condition management services in partnership with DocGo On Demand. The pilot is part of Dollar General's health initiative, dubbed DG Wellbeing, and accepts Medicaid, TennCare, Medicare, and certain plans under major health insurers, with flat rates starting at $69 for those without insurance. In July, the chief rural care correspondent for KFF Health News visited one of the 3 mobile health sites in Tennessee, noting that many customers pass over the clinic despite its location in a federally designated primary care shortage area. So far, approximately 1,000 patients have been seen in the clinics at Dollar General sites or community events. The community reviews have been mixed. One small business manager 10 miles out from a Dollar General mobile clinic site told KFF that the retailer and healthcare don't go together. "I wouldn't want to go to a healthcare clinic in a parking lot. That's just me," Michelle Green said. All mobile clinic visits are overseen by a licensed nurse practitioner, physician's assistant, or physician. One family medicine physician, Brent Stanton, MD, told KFF that he thinks Dollar General is underestimating the magnitude of healthcare delivery. Honestly, they don't really grasp, I don't think, what they're getting into, Dr. Stanton, who heads accountable care organization Cumberland Center for Healthcare Innovation, told KFF. While some community members may be concerned about the legitimacy of receiving medical care in a parking lot, KFF also shared voices of support and satisfaction with Dollar General's Little Clinic on Wheels, as one resident put it. Bobby Stokes, who's nearly 80 years old, said he used the mobile clinic before it moved locations. His wife couldn't breathe. They pulled into the parking lot and climbed onto the van. "We wasn't in there 5 minutes," he said. "They done blood pressure test and what they needed to do and put her in the car and said, get her to the hospital, to the emergency room. The DocGo staff," he said, "did not ask for payment. Nothing. They were more concerned with her than they were with, I guess, getting their money," he said, adding that his wife is doing well now. "They told me to get there, and I took them at their word." It is obvious that this is in the beginning pilot stages, and it will take time to truly assess where this is going to end up. There's 60 million people in America that live in rural communities, with many of them in declining healthcare areas. We are not under an illusion. We know that Dollar General is not doing this out of the kindness of their heart. Dollar General is looking to make a profit from this high healthcare demand. Of these 60 million Americans, their families account for $2.2 trillion of the American GDP, which is roughly 10%. However, before they can even begin to see any profit, I think their biggest challenge is going to be trust and stigma. Dollar General has been long associated with being a low-cost provider, and as stated in multiple reviews, many people cannot imagine having their healthcare being associated with Dollar General. They will have to figure out a way to break through the stigma of cheap, discounted, bargain, etc. These are not terms you want associated with your healthcare provider in terms of service. I would argue the only way to truly make this successful is to make totally independent clinics unaffiliated with the Dollar General brand. I think people will be more likely to trust the care clinic, and they would not have to navigate those branding issues. Regardless, it's obvious there is a need for this, but the road will not be easy. How they get there will determine their success and potential to scale this business. So now it's your turn to tell me what you think. Do you think this will benefit these rural communities or hurt them? Do you think Dollar General should associate these healthcare clinics with their Dollar General brand or leave it separate? I would love to hear your thoughts on this topic. Leave your comments below. Please like, share, comment, and subscribe. Thanks for watching.